This is Tom Lee, editor-in-chief of NEJM Catalyst, and I'm talking today about relatively recent healthcare politics with David Blumenthal. David has played so many interesting and important roles in healthcare over the course of his career, but my guess is that he's best known to many of you for his work as the National Coordinator for Health Information Technology from 2009 to 2011, and president of the Commonwealth Fund from 2013 to 2023. He has been in the middle of the political fray all along, and I'm not going to go into all the ways in which he's had impact for the good on our healthcare system, but he's also a wonderful observer of it. I love the first book he wrote with James Morone called The Heart of Power. It was published in 2009, and it described how modern presidents have managed health policy issues. But a lot has happened since 2009. An incredible amount has happened. So David and his co-author are just publishing a new book. It's called Whiplash, From the Battle for Obamacare to the War on Science. It describes and analyzes the actions of three presidents: Obama, Trump 1, and Biden. Now, I know that it is an election year, and it's also tempting to say that everything is a mess. But our issues are more complex than that. And this new book helps explain how we got here. And it also captures some of the things that went right, intentionally or otherwise. So I asked David to come talk today to highlight one thing, the best thing, that each of these three presidents led over this 16-year period of 2008 to 2024. We're going to stay out of more recent issues like the big, beautiful bill, at least for today, and instead focus on what went right under each president and see what we might learn from that. David, first, though, let me ask the big picture question of what led you and your co-author to take this new book on.
Well, Tom, first of all, it's a pleasure to be with you on this podcast, and thank you for your very kind comments. What led us to write this book is that we had seen from the first book you mentioned how important presidents are in shaping healthcare in the United States, something that hasn't always been true, but has been true in the modern presidency. And as you pointed out, these three men had done some very remarkable things. And we thought it was important as a sequel to that first book to continue the story of presidential leadership and influence on American healthcare. Basically, nothing important for good or bad happens to healthcare in the United States unless presidents play a part.
Well, I would encourage listeners to think about going back and reading that first book because it's on my shelf behind me now. And I would just say, if you're interested in history at all, read the stuff on Lyndon Johnson. It's so interesting. It's so important. And parts of it are hilarious, too. It's a wonderful, wonderful book. But turning to the more recent era, let's talk first about the Obama presidency. I have a sneaking suspicion that I know what you're going to say was his greatest healthcare achievement, but I also know that you have special insights into what made it so great. You were right there on the edges of the action and in the middle of the action in many cases. So let's hear what went right during that 8-year period.
Well, I think we lose track in the contentiousness of the current time of what an important event in the history of our country the Affordable Care Act was. With the Affordable Care Act added to Medicare and Medicaid, we had the ability through congressional action without passing new legislation, but just budgetary allocations to ensure virtually all Americans, a 100-year dream of progressives and of many Americans, if you look at the polling. And we have it now, and it has been under-recognized as an achievement, and it all flows to decisions that Barack Hussein Obama made in the first week of his presidency. Decisions that he made against the advice of all his near-in wise advisors, Joe Biden, Rahm Emanuel, David Axelrod, David Plouffe, all the people who've been with him through his campaign said, forget this dream. It's going to kill your presidency. And Obama, for deep personal reasons, decided to go forward and make it the central point of his presidency. One man, a president, made that possible. And throughout the trials of that passage, which were many, he repeatedly refused to take off-ramps and go for more modest accomplishments like children's health insurance or just expansions of Medicaid. He wanted the whole thing, and he got it. Not perfect, a Rube Goldberg machine, but when we talked to him, and we spent an hour with him talking about his presidency, he remains extremely proud of it, and he believes that it was the best that could be done given our politics, our healthcare system, and the ability of Americans to, and the willingness of Americans to tolerate change.
Well, it is a great story, and I know you know it in great detail. And maybe you can, you recently told me about why he did it. And I think that's a little vignette worth sharing because it's so lovely.
Well, we found in the first book, Tom, that presidents' personal stories, their personal histories with healthcare, and especially those of their family, can be incredibly important in how they act and move on healthcare issues. And in this case, when we talked to President Obama, we gave him 5 or 6 opportunities to tell us why he took this high risk, high gain route to initiating his presidency. And he said without hesitation, it was his mother. His mother's struggle when she was dying of cancer to get her health insurance to cover her expenses. And he watched that, and it was painful, and it was a lasting impression that motivated him to keep pushing this very improbable accomplishment. So, the personal is politics often, and in healthcare, that's more so than in most other areas of American politics and policy.
Well, on a personal basis, for me, I can tell you that, as you know, I see primary care patients in a teaching clinic at a teaching hospital in Boston. And we have always cared for anyone who comes. And we always have had a lot of uninsured patients up until healthcare reform passed. And since healthcare reform passed, all of my patients have had insurance. And so we can easily forget how big an achievement it was. But you're right, it was huge. And if any of us run into Barack Obama, I think we should be saying thank you to him for that. Well, after Obama came Trump 1, and you have written about there are high points of his healthcare impact. Can you expand on them?
Yeah, this was something that somewhat surprised my co-author Jim Marone and me. The fact is that after a period of indecision, confusion, and misdirection, once the President Trump, became convinced that this was a serious illness, that it was a genuine threat to America's health, he did something that is truly remarkable in the history of human affairs, really the history of life on this planet. He led the creation within 11 months from the detection of a new pathogen, the development of a vaccine or several vaccines that were 95% effective against hospitalization and death from a new pathogen. That has never occurred since one-celled organisms arrived on Earth during the primordial oceans. There have always been viruses and bacteria and fungi that have wreaked havoc on life, and those life forms have never had a defense except the development of innate immunity, but that's often very painful and a long process. And here, modern science, led by a president who put the full power of his office behind it, which wasn't inevitable, created that vaccine. And there were a number of important management decisions that he made and that the people who worked for him made that resulted in that success. It was very consciously patterned on the management of the Manhattan Project that created the first atomic bomb at the end of World War II. It was actually called briefly the Manhattan Project 2, but then Operation Warp Speed became the new name when, interestingly, the Japanese voiced strong objection to elevating a project like this to be called a Manhattan Project 2. Anyway, the management of that project, hiring a superb scientist and a superb logistician, Dr. Slaoui and General Perna, the close collaboration between the Department of Health and Human Services and the Department of Defense, which was critical. President Trump's personal supervision through his son-in-law, Jared Kushner, who represented him in all the conversations around Operation Warp Speed, resulted in the success that we had. It was by no means inevitable. The science was there, a wonderful and fortunate event, but it could have been missed. And this president, impulsive, headstrong, and focused on success once he decides on something, his style lended itself to success in this case.
Well, that is a great perspective. And the driving of the collaboration across different parts of government and the scientific enterprise, I had not appreciated how important that was. I do know that my friends who worked in one way or another on Warp Speed, they look at it as one of the high points of their professional careers, just as the way my friends who worked on the ACA look at that as one of the great things from their time.
Just to put it in perspective, how many presidents can say that they did something that saved millions of lives and trillions of dollars in a matter of months? Think about that as an individual accomplishment from a single person through his or her energy and commitment. And I think, unfortunately, the president does not claim credit for that anymore because of the post-pandemic politics. But we need to understand what an enormous accomplishment this was for the country and for the human species.
No, your book really does send that message. One person can make a difference. It helps if you are in the position of being able to make big decisions. But I think one of the takeaways from your writing is, one person can make a difference regardless of who you are. And I hope that will be one of the messages that readers extract. But let's turn to the Biden administration, those 4 years. What were the high points from your perspective?
The Biden administration had two phases, the first 2 years and the latter 2 years. Perhaps someday the full story of President Biden's health and what happened during the latter part of his presidency will be told. But in the first 2 years, he was an extraordinarily effective leader, had legislative accomplishments with few parallels, except those of Lyndon Baines Johnson, whose presidency you mentioned, and who stands as probably the most impressive domestic leader in modern times. Joe Biden had comparable accomplishments legislatively, but equally impressive was his vaccination campaign. Now, we, in the midst of this current time, are so aware of the controversy over vaccination and of the increased public ambivalence that has resulted from the positions of current leaders that we forget how important vaccination was in bringing the pandemic to a close, turning it into a manageable infectious disease, not so different from influenza. And how did that happen? Well, producing the vaccine was critical, but distributing it was equally important. And Biden did that. He did it because and was able to do it because, as a longtime senator and former vice president, he thoroughly understood how to make government work. And he brought that knowledge to bear on a vaccine distribution program that put 200 million inoculations into Americans' arms in the first 100 days of his presidency. 200 million doses in 100 days. What an extraordinary accomplishment. And how did it happen? It happened by using the Department of Defense and the military to set up vaccination centers, FEMA to set up vaccination centers, the network of community health centers to make sure that underserved populations had access to vaccines, Walmart, Walgreens, CVS, private sector, under the leadership of the man who became his chief of staff, Jeffrey Zients, who was a masterful government manager and widely known for that, and was the original COVID response coordinator. So that was, I think, something that not every president would have been able to accomplish, and Biden was extraordinarily well prepared for it. So I think that is another really important high point for his presidency.
Well, those are three great things. And I know there are other positive things that you describe in your book, but, providing access to care through the Affordable Care Act, making possible the big scientific breakthrough of the vaccinations, and then the delivery of that breakthrough during the Biden administration. It's almost like it was planned. We know it wasn't, but things would be much worse, and there would be people who are listening to this podcast and reading the transcript who would have tragedy in their life if those things had not happened. Now, the country would be in a lot worse shape if they had not occurred. Can you wrap up by tying some of these thoughts together and finding a common theme for what characterizes a president rising to the occasion in healthcare?
Well, I think there are a couple of things for presidents who want to do big things in healthcare. First of all, they have to be passionate about it. Secondly, they have to plan for it during their election and arrive with a plan. Thirdly, they have to have the courage to execute on that plan against inevitable political backlash. And fourth, they have to know how to work the Congress, because as my colleague Jim Morone says, it's an infernal machine, which in many ways has been created to stop progress rather than to execute it. And it also really helps if a president understands the American government. It is not a job for on-the-job learning. Those first few months of a president's first term, set the pattern, are incredibly valuable for any major accomplishments. Lyndon Johnson, that incredible wizard of American politics and policy, after his 1964 landslide election, called together all his major advisors and said, every day I'm going to lose votes. Every day I'm going to make someone angry. Whatever we want to accomplish, we have to accomplish it right away. And that's how he went about creating the Great Society and Medicare and Medicaid. The same is true of healthcare in every presidency.
Well, David, that is a fantastic summary. And I hope that readers of your new book will make sure they come away with that prescription. There are learnings to be obtained from what went right. Yes, there are criticisms to make, and it's important that people make those criticisms, but learning from what went right is really valuable for leaders at all different levels. So thank you so much. And I always enjoy reading your work. As you know, I am hopeful that there will be more to come. And we'll have you again in NEJM Catalyst sharing your insights with our audience.
Thanks, Tom, and thanks for all the things you do to help your readers and healthcare in general work better.
Is race a medical fact or a flawed assumption? What happens when medicine gets race wrong? I'm Rachel Gottbaum, and this is Intention to Treat from the New England Journal of Medicine. Join us for Season 2, The Race Equation, where we examine assumptions about race that are harming patients. Listen and subscribe to Intention to Treat wherever you get your podcasts.